This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Senior Corporate Communications Officer, Ministry of Health, Al Alexander.
Good morning, Trinidad and Tobago, and welcome to another Ministry of Health's update on the national COVID-19 response. It is a pleasure to be here with you once again. Today on our panel of presenters, we have Dr. Avery Hines, Technical Director, Epidemiology, Ministry of Health, and Dr. Sana Mohammed, Pulmonologist, North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Avery Hines will begin with the latest clinical, vaccination, and epidemiological updates. Dr. Hines?
Thank you, Mr. Alexander. Good morning to my colleague, Dr. Mohammed. Good morning to the members of the media, members of the viewing and listening public. If I can have the first slide, we'll go straight into the clinical update. That is with data as at August 2nd at 4 p.m. At that time, we had tested 269,723 individuals, and of those, 39,039 returned positive tests. Of those individuals, 32,129 have already recovered. There have been 1,092 deaths, and we extend our condolences to the members of those bereaved families. And there are currently 5,818 total active positive cases, which are distributed as follows. There are currently 314 individuals hospitalized, 5,306 persons in home self-isolation, and 89 individuals in step-down facilities. Yesterday's testing would have revealed an additional 109 new positive cases, and those samples from yesterday would have been collected during a period of July 29th to August 1st, 2021. There are currently 165 individuals in state quarantine facilities. Now, on to the vaccination update. As at yesterday at 4 p.m., we have completed 395,743 first dose vaccinations, and persons fully vaccinated currently number 195,086. Now, we have a few important points to make about the vaccination and the vaccination drive. As we move into this accelerated phase of vaccination, one of the things that all of the RHAs are rolling out is additional outreach for communities where they do pop-up vaccination sites at various either community centers or schools, grocery car parks, places like that that will be scheduled and announced by the various RHAs. I believe Eastern RHA has already published a schedule. Southwest RHA is soon to do so. So we do encourage all individuals to take a look at the relevant websites and listen out as those sites are published and announced, so that if you haven't yet gotten your vaccine, you can make your way to those pop-up sites to do so. We are encouraging everyone who has already been vaccinated to continue to adhere to those public health measures. We've simplified them into the 3 W's: washing your hands, wearing your mask, watching your distance. And as we move forward, we have people traveling a little more frequently. We have that global threat of a new variant that is more transmissible, that Delta variant. We want to again underscore the absolute importance of having your vaccination. The more vaccinations we get into arms and into people ahead of any potential introduction of a new variant, the better off we will be in reducing the risk of spread. Now, this new variant, as we had spoken about before, I think Professor Carrington mentioned it, the CMO mentioned it, this new variant has one of the features that worries public health personnel, and that feature is that it is more highly transmissible than the variants that preceded it. So whereas the original virus might have affected 2 people for every one original or one what they call index case, with this particular virus, it's somewhere between 4 and 8 new cases that can come up from any one index case. And as a result of that, what you're seeing in populations that aren't well vaccinated is that they're again having spikes, large numbers, as this virus works its way through the unvaccinated population. What we've seen again in international jurisdictions is that the most affected individuals are the ones that aren't vaccinated, both in terms of severe illness and in terms of fatalities. And we see the same thing within our own local population as we continue to collect data. As the CMO would have presented recently, we see that in our local population, in our local hospitalizations, we have mostly unvaccinated individuals hospitalized. There's a small proportion of individuals that have had one vaccine, so they're not fully vaccinated. And among the seriously ill and among the fatalities, there have not been any fully vaccinated individuals, which is in line with what the international data is showing, that full vaccination helps to reduce your risk, both of serious illness and of fatality. So we want to encourage everyone who has access to the vaccine to go ahead and get the vaccine into your system so that we can reduce our risk as a population of having large additional waves of virus if a new variant is introduced. So with that, I'm going to go into the epidemiologic update. So can we have the next set of slides? As at yesterday, that is August 2nd, this is what our epi curve looks like. Over to the extreme right, the dark blue or indigo color is the color that we've chosen for the month of August. And as we move forward, we will see more lines along the right-hand side of the graph in that color. So up to today, what we're seeing is that downward trend that we were initially looking at from the month of May into June sort of level off or plateau or get to a flat section. That month of July, that fuchsia set of bars, is largely just about the same height. In fact, if you look at it carefully and you look at the rolling average, we note that there is a slight upward trend throughout the month of July. Not steep, but notable. And because of that, we want to continue to encourage everyone to continue to adhere to those public health guidelines, especially as we have a little additional movement in the population at this point in time. Next slide, please. Looking at that same information now aggregated on a weekly basis, we see basically the same shape. We see that the gold bars were the highest. Those were the months of that was the weeks in the month of May, into June with the turquoise, into July with the fuchsia, and what we saw between the completed week 29 and completed week 30 is again that sort of leveling off. There'd been slight increases, 1%, 5%, 8% in the 3 weeks before. And then between week 29 and week 30, we have basically the same number. There's a small drop, 0.3% drop. We're going to count that as negligible and attribute that entire trend to a plateau between last week and this week. And looking against the backdrop of the positivity, you're seeing that positivity has continued to hover somewhere in the late or low 30s rather. High 20s into low 30s throughout that same time period. So there's a balancing act, there's an equilibrium that's in play, and we need to do everything we can to maintain the equilibrium or to put our forces into the downward side of that equilibrium, driving the cases downwards. Moving into the next slide, we see the same data again aggregated at a monthly level, and we have so far up to the month of July, the 6,000 plus cases. We're now looking at the first few days of August, first 2 in this case, and we're seeing that downward trend continuing with overall monthly percentage positivity. When we get another day or so of data, we'll put up the additional positivity for the month of August. Next slide, please. Looking at the demographics, we will see that this graphic has maintained basically a similar shape throughout the epidemic, where we have small numbers at the bottom and smaller numbers at the top, and in the middle, that midsection of the population, the 25 to 49-year-old age group is where we have the majority of our cases. We also see that the basic male-female ratio is about 50-50 right now, and that has been like that for the last several weeks. Next slide, please. Moving on to the fatalities, what we do see is that distribution that we've been alluding to, where we see the majority of those fatalities occurring in persons over 60. But there have been individuals under 60 that have had fatal outcomes, and the majority of the individuals with fatal outcomes have also had comorbidities. And this is where we want to encourage people in the older age groups, individuals with comorbidities, to be extra aggressive, for want of a better word, in seeking out your vaccination. Make sure that you get vaccinated so you reduce your risk of adverse outcomes. So just to tie up the epidemiologic update, at present we're seeing a continued plateau in the number of cases, not going up or down very rapidly, and we want to encourage the vaccination uptake as we try to put as much force as possible into the downward or the decreasing transmission side of that equilibrium. So we have extra movement on one side, and we need to reduce transmission by adhering to the public health guidelines and accessing vaccination to the greatest extent possible. So with that, I'm going to turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. According to the World Health Organization, people with asthma, or PWA, generally are considered at higher risk for respiratory infections, as it is seen annually with the influenza or the cold. But also, does that translate to COVID-19? Are persons living with asthma at higher risk of contracting COVID-19, getting sick, or even succumbing to the virus? Here to answer these questions and more, I am pleased to welcome Dr. Sana Mohammed.
Good morning, everyone. Thank you, Al. Dr. Avery Hines, Technical Director in the Epidemiology Division, Ministry of Health, members of the media, and members of the viewing and listening public. Today, I have the pleasure of speaking about asthma and COVID-19. Since the onset of COVID-19 pandemic, there have been worldwide about 198 million infections and just over 4 million deaths. Locally, we see similar trends in our numbers. As we know by now, COVID-19 presents with a spectrum of illness. Some patients can be asymptomatic, that is, having absolutely no symptoms, while others might have moderate to severe disease. For the past year or so, this has become our day-to-day reality, where each of us knows someone personally who has had COVID-19 infection, and unfortunately, some of us sadly know persons who have succumbed to COVID-19 infection. There are many risk factors for severe disease. May I have my first slide, please? So some persons are more likely than others to become severely ill from COVID-19 infection. Severe illness means that a person with COVID-19 may require hospitalization, admission to the intensive care unit or the ICU, or they may even die. Some of these patients with severe illness also requires ventilators to help them breathe. So what are the risk factors for severe COVID? Well, older persons are more likely to get severely ill from COVID-19. Some coexistent medical conditions make you more likely to become severely ill from COVID-19, and these include cancer, heart disease, diabetes, obesity, and underlying respiratory diseases such as asthma. It is therefore crucial, as Dr. Hines said, that persons at increased risk and those who live with and visit these persons need to take precautions to protect themselves from getting COVID-19. Let's focus now on chronic lung diseases. Chronic lung diseases are very common. We each know someone personally with asthma. Other chronic lung diseases include chronic obstructive pulmonary disease or COPD, having damaged or scarred tissue called interstitial lung disease, and pulmonary hypertension, that is, having increased blood pressure in your lungs. All of these chronic lung diseases can make you more likely to get severely ill from COVID-19. May I have my second slide, please? So this information is taken directly from the CDC. We know that people with moderate to severe or uncontrolled asthma are more likely to be hospitalized from COVID-19. If you have asthma, it is therefore crucial to take steps to protect yourself. Firstly, you should ensure that your asthma is well controlled and seek medical attention where needed to achieve this. You should follow all the usual guidelines to prevent COVID-19, including wearing a mask, social distancing, hand washing. But one of the most important recommendations to protect yourself is to get a COVID-19 vaccine when it is available to you. All COVID-19 vaccines are very good at protecting you and your loved ones from having severe COVID-19 symptoms, staying in hospital, or dying from the virus. And although there are few reported side effects, COVID-19 vaccines are generally safe and very effective tools in the fight against this pandemic. If you or a loved one has asthma or any underlying respiratory illness, I would urge you to get vaccinated against COVID-19. If you live with, care for, or visit someone who has asthma or any risk factor for severe illness, I would also urge you to get vaccinated against COVID-19. Fortunately for us locally, there are numerous vaccination sites across the nation where COVID-19 vaccines are widely available to members of the public. These vaccine sites are doing phenomenal jobs, ensuring ease of access to vaccination. If, however, you are unsure about the vaccination, you should feel free to reach out to your local healthcare provider and ask any questions or ask any more information that you should require to finalize your decision. So we spoke about severe COVID-19, but what we also know is that there are patients who are at risk of post-COVID conditions. May I have my third slide, please? Post-COVID conditions are a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after first being infected with the virus that causes COVID-19. These post-COVID conditions may also be known as long COVID, long-haul COVID, post-acute COVID, or chronic COVID, and there are many other names that we refer to them as. The most reported symptoms are profound fatigue and shortness of breath. But as can be seen on the slide, patients can complain of many symptoms from a wide range of body systems at different times and at varying severity. In fact, every single body system can be involved. What is important is that the best way to prevent some of these post-COVID conditions is by getting vaccinated against COVID-19 as soon as you can. It is extremely important for us, the population, to follow all the public health guidelines continuously recommended by the Ministry of Health, including mandatory mask wearing while in public, social distancing, staying at home if you are ill, and washing hands. Fortunate for us, we now have at our disposal vaccination, which is a key tool in the fight against this pandemic. I would urge members of the public to become vaccinated against COVID-19 if you are eligible to do so. I would also encourage you to be responsible and encourage your friends and family to do the same. Vaccination may save your life or the life of a loved one. Remember that we're all in this together. I thank you for your attentiveness.
And thank you very much, Dr. Mohammed. This morning, I am pleased to introduce a new segment to these COVID-19 updates, where we reach out to you, the public, to hear your concerns and have members of our panel answer your questions. So without further ado, let's hear you speak.
This is Richard Trumpet. Now, we know you have your concerns about the COVID-19 vaccine. So today, the Ministry of Health came downtown Port of Spain to hear from you about your concerns and your questions.
What is the mortality rate after taking the vaccine?
So I'll take the first question. So with regards to the mortality rate after taking the vaccine, we can look at this from two angles. The first angle is have there been any fatalities following vaccination for the general population? And the answer is no. We have not reported any patients dying due to the vaccination following vaccination with the COVID-19 vaccines. The second way we can look at this question is whether or not there have there have been any fully vaccinated persons who have died from COVID-19 infection. And as CMO related to us just Saturday gone at the press conference, there have been no cases of fatality nationally amongst those who are fully vaccinated against COVID-19.
So why is it only certain vaccine allowed in certain countries?
Okay, thank you. I'll take that second question. Now, each country has the right to make its own decisions on which vaccinations it will accept, which vaccinations it will consider as being valid. What Trinidad and Tobago has done is it has ensured that its decision is in line with the WHO approvals for vaccinations, and the WHO approvals in turn are in line with careful review of the data available on each of these vaccines. So Trinidad and Tobago has chosen that method, but other countries can choose whichever method is suitable to them for deciding which vaccines they are going to consider. So it is a country-by-country sort of decision, but we've decided to align ourselves fully with the WHO.
Why does we have to sign a form to get this vaccine? All the other immunization shots, you never had to sign a form. So in my book, I feel like I'm signing away my life.
So I'll be happy to take this question. So the forms that have to be signed prior to COVID-19 vaccination basically are asking the same information that would be required for you to register at a health center or to go to a doctor's visit. It's basic demographics, asking your name, age, date of birth, address, and also contact information. Contact information is crucial so that if there are any adverse effects, we'll be able to contact this patient to identify this patient. The other bits of the form are basically a screening questionnaire to make sure there are no contraindications or reasons why this patient should not be vaccinated against COVID-19. There are also general questions to make sure that these patients don't have fever, don't have cough, and are feeling very well on the day of vaccination. But what's important is that the last part of the form asks about you giving consent to be vaccinated against COVID-19. And I appreciate that may be a concern for many, but in medicine, we're moving towards shared decision making where we empower our patients to help with their decisions while providing them enough education to do so. So this is a reason that we are asking patients to consent to the vaccine.
What are the effects of vaccinating the kids, and what are the statistics behind it that no harm will come to them in the future, like a year, 2 years, 3 years after?
Okay, I'll take that one. Now, globally, what we've seen is that at first, the vaccinations were only approved for adults, and then certain vaccinations became additionally approved for individuals from 12 to 18 years old as the research continued, as the trials continued, as additional observation of vaccines in those age groups continued. At present, Trinidad and Tobago does not have any of the vaccinations that are WHO approved for the age groups below 18. And we, as a global community, can't yet say with any certainty anything that will happen a year from now. But we do know that with any new intervention, whether it is a medication or a vaccine, most of the issues that crop up very soon after exposure. And in this very soon after exposure time frame, everyone has had generally very positive results. Reduction in rates of transmission, reduction in rates of serious illness, and minimal, if any, sort of side effects as a result. So the vaccines are so far safe for the kids, the ones that have been approved, and as additional data is collected, you'll have a better idea of what happens in the long term. This is still a developing field of knowledge. We're still collecting information on that. So we will continue to update as more information, of course, becomes available.
So you had the questions and we provided the answers. Look for us coming very soon to a location near you. In the meantime, don't forget the 3 W's. Wash your hands, watch your distance, and wear your mask.
that was our You Speak segment. I want to thank the public for posing these very important questions. And ladies and gentlemen, I invite you to have your questions and look out for the Ministry of Health's You Speak team as they visit communities throughout the nation to hear your questions and concerns on the COVID-19 virus and the vaccine. We now move to the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking your two brief questions. Please ask your questions one right after the other to the relevant members of the panel. And of course, if time permits, we will accommodate a second round of questions. This time, one question per media house. Today we begin with Guardian Media.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my questions this morning are for Dr. Hines. Now, Dr. Hines, on the last occasion you were on here and I asked about the Ministry of Health tracking of breakthrough cases, and you gave an indication that it's not really being done. I mean, I'm oversimplifying there, but I'm wondering something. If we're not really tracking these breakthrough cases, what is the criteria the Ministry of Health is going to use when advising the Prime Minister on whether to increase restrictions or loosen restrictions, especially since we know that it is possible for a person who is fully vaccinated to end up showing up as a COVID-19 case after being infected, whether it's asymptomatic or symptomatic or whatever, right? Because up until this point, we've been looking at active cases to kind of guide us when it comes to hospitalization rates and those kind of things. So what is that criteria that is going to be done if we're not per se tracking breakthrough cases?
Okay, so thanks for that question. It gives me the opportunity to clarify what may have been misunderstood by what we said. The breakthrough component of the new cases is what we don't necessarily have the denominator data on, and it is because not every person who is tested and who comes up as a positive case has their vaccination status documented. So whereas we have and we continue to track, we have tracked and continue to track all of the new positive cases, whether they were vaccinated or not, what we're not attempting to do is give a sort of a rate of breakthrough, given the fact that we don't really have a proper denominator on how many of the people may or may not have been vaccinated who subsequently developed COVID-19. So we're not trying to track that per se, because what's more important is whether or not serious illness and death is occurring in those cases. We will note, and you see in other countries, that as the vaccination rollout continues, in spite of the fact that some countries continue to see new cases, some countries even saw additional or rises in cases as they had more movement, release of restrictions, etc. What was being monitored there as well is the proportion of serious illnesses and deaths that are arising out of the new cases. So the metrics that are being used don't change. The metrics that are being used are how many new cases we have, whether they were vaccinated or not, whether we are seeing those new cases translating into filling up our hospital system or not, whether we're seeing those new cases resulting in the same or a higher or a lower proportion of deaths from COVID-19. That's what the tracking resource is being utilized to follow, as those are the more important outcomes from a public health perspective. So just to clarify, we continue to track all cases of COVID-19, whether they are breakthrough after vaccination or not. What we are not doing or not attempting to do is to give a denominator or rate of breakthrough, because we know that we don't necessarily have vaccine status for each individual that has been tested positive, and therefore the rates may be inaccurate, and we try our best not to give inaccurate data. So I hope that clarifies. Was there a second question?
No, just one.
Okay.
Thank you very much, Dr. Hines. We now go to Power 102. Power 102, we are ready.
Good morning, Sparkle McIntosh, Power 102 Digital. Both of my questions are directed at Dr. Hines. Our newsroom was informed of an incident in which an elderly female was seeking medical attention at the Port of Spain General Hospital. However, after 3 days, she was not able to be warded because no beds were available. Similarly, there were no beds available at Mount Hope Hospital at the time of inquiry, so having the patient transferred was not an option. Unfortunately, this person died. So my question is, with so much emphasis being placed on the parallel healthcare system, is it a case where the primary healthcare system is now experiencing some sort of a collapse because not many people who are trying to seek medical attention for non-COVID related symptoms are still experiencing difficulty in being treated? And my second question would be, with the substantive push to have persons vaccinated, can you give the expiration date for the 800,000 Sinopharm vaccines that Trinidad and Tobago received? Thank you.
Okay, so with respect to the first question, no, there isn't any collapse at the what we call the traditional healthcare system level. Traditional healthcare system services continue to remain available and functional and to provide care and healthcare to those who are seeking it. While I cannot respond directly to the case that you just referred to, and that query or those queries would probably best be directed to the relevant RHAs. What we can say is that across the board throughout the system, the primary or the traditional healthcare system continues to function as it is meant to. Now, the question of the expiration date for the Sinopharm vaccines is June 2023. So we do have a good expiration window within which to work. Of course, we would very much like to have all of those utilized long before that expiration date and utilized in as short a time frame as possible.
Thank you very much, Dr. Hines. We now move to 103 FM.
Good morning, everyone. Sarah Chandu from 103 FM. My two questions pertain to vaccination in the country. First of all, referring to the stats provided in the daily media release, we see that about 3,200 second doses were administered between Friday and yesterday, Monday. Would you say we have an issue? It seems a bit low. Maybe you could say otherwise, but does there seem to be an issue with persons showing up for their second dose of the relevant COVID-19 vaccine? And also there have been reports over the weekend, a long weekend, of a lot of mass vaccination sites not having a lot of traffic. So would the country by chance be nearing that threshold of persons who would want to be vaccinated being vaccinated? And what would that mean for the country opening up? Because it seems as if a lot in terms of the restrictions would depend on vaccination. Thank you.
Okay, so let's work backwards. The second bit of the question, I think, is, well, the two questions are linked. The long weekend that we had, I'm not 100% certain that everyone was aware that vaccination was continuing, so there may have been just less access because of the assumption that vaccination wasn't available over the time period. Now, that being said, we don't yet think that we're reaching that point where there was any sort of, for want of a better word, saturation of those who have desired to be vaccinated just yet. We have not yet reached that point, and people are continuing to come out for their first dose. Bear in mind also that there is a relationship between the timing of the first doses and the timing of the second, so that the appointment schedule for the second vaccine is actually determined by when people got their first. So sometimes there may be a lull depending on whether there was a big thrust or a big drive just before and then smaller numbers taking the first vaccine thereafter. So those things do influence the sort of flow through the sites, but we do want to encourage all members of the population who have not yet been vaccinated to continue to access the sites as vaccines are being made more widely available throughout the 109 health centers and at the pop-up sites and at the mass vaccination sites to facilitate all those who would like to be vaccinated. And to answer what that means in terms of opening up as the situation continues to unfold, as more people become vaccinated, then the changes that we see in the actual transmission of the virus, the additional threats that may occur or arise with respect to any introduction of variants, all of those things are going to be factored into additional decisions being made moving forward. So it will be preemptive to speak about what anything would mean in terms of opening up at this point. We speak with the data we have in hand.
Thank you, Dr. Hines. We quickly move to TV6. Good morning.
Good morning, Urvashi from TV6. Dr. Hines, I just have my two questions are directed to you. Could you, a couple of weeks ago, Dr. Trotman would have told us about this new drug, tocilizumab, that was being used or has been approved for use in Trinidad. Can you give us Trinidad and Tobago, can you give us any update on that drug, its success rate so far? And if there are any other treatment options that you all are looking at on the horizon. Secondly, can you give us an update on how many doses of the Sinopharm vaccines are still available and how many would be reserved for second doses? Thank you.
Okay, let's move backwards again. In terms of how many doses are reserved for second dose, at any point in time, we reserve half of the stock in hand for second dose. So while I ask for any additional information on the actual number of doses currently available, and we'll probably be able to get that to you a little later in the broadcast, basically the math is half of the available stock is used for first dose and the next half is reserved for the second dose. Now, your first question is actually more question within the clinical domain, where the clinicians who are treating the cases at the wards will be able to tell you a little bit more about success rates with the new medication. But what we do know, what I do know at the national level, is that the medication has a particular mechanism by which criteria utilized to decide when it is needed, and that is being done as we speak. That medication is being given to those who require it based on the clinical presentation. I don't know if Dr. Mohammed has any additional information on that at this point, but the overall understanding that we want everybody to have is that as we get additional tools in the armamentarium, we utilize them to the best of our clinical and public health ability. So that is happening, and it will take a little more time before we can speak really about rates of success, given the fact that it will be small numbers of individuals at this point in time, and the need to review background info on additional, comorbid conditions, etc., will factor into how you assess a success rate. Nonetheless, we will also endeavor to get back to the public with any additional update or info on the success of utilizing that treatment. So when we get more info, hopefully soon, on the number of doses in hand, I'll give you that stat, most likely within the course of this broadcast.
Thank you very much, Dr. Hines. We now go to AZP News.
Good morning, Priya Bihari, AZPnews.com. Dr. Hines, you spoke about the plateauing of the COVID-19 cases. What about deaths, and what about the active cases? Are they also plateauing, or are they decreasing or increasing? Can you give us an idea of that? And my second issue, just some people have been complaining that the 800 well number, 877 well number, they are taking some time to have it answered. They are waiting like 20 to 30 minutes. I don't know if anything could be done with that aspect of the phone lines. Thank you very much.
Okay, thank you for those two questions. Now, what we see, it's published as an update every day on the actual daily COVID-19 release. What we're seeing is a slow decline in the number of active cases. So we're seeing that coming down slowly. Some days it goes up a little above the previous number, depending on how many new cases were diagnosed or came out of the laboratory system the day before. But overall, there is a slow downward trend. And so too with the fatalities, we are seeing that there are days of several days of smaller numbers, although every once in a while you may see a slightly larger number crop up, and it really just depends on who is in the system at the point in time, how severely ill those individuals are, what the comorbidity mix is in that ill population. So that will vary, but the numbers have trended downward somewhat over the past couple of weeks also. Now, the 877, well, we'll refer that query to the technical folks who actually monitor that hotline, and we'll see if there's anything that's responsible for, and therefore anything that we can do about that. That's not a question I can answer immediately, but having taken this statement on board, we'll definitely look into that and ensure that we have an improvement in as quick a time as possible. Going back to the question on number of doses, as of Saturday, there were 16,000 second dose AstraZeneca still in hand, and 63,000 Sinopharm. No, this is
total.
What's this? This is a handwriting issue.
Yeah.
Say again?
63,600.
Okay, 63,600 additional doses of the SP. Now, this is a rolling tally as we speak. Now, that was as of Saturday. Today is Tuesday. That number will have already changed, and we just continue to roll out as the days go by. So, rest assured that we are seeing good uptake with the doses that we do have available at this point in time. Good. See, now this is the issue. The issue was that there was a comma in the wrong place. This figure makes more sense to me. Let's correct that. 636,000 doses of Sinopharm in hand. That number I can understand. 636 doses of Sinopharm, and we are rolling out as quickly as possible.
Thank you very much, Dr. Hines. We now move to Radio Tamron. Radio Tamron, we are ready for your two questions.
Hi, good morning. Clayton Clark, Radio Tamron. My first question is to, I think there's a pulmonologist there. Forgive me if I can't remember your name. There's a report, or there are reports of an elderly man who took the vaccine and reportedly died. And the family is wondering if there's any link between, well, he had apparently a drop in platelet blood count. If there's any link or any concern should be noted between being vaccinated and blood count, low blood count, etc. And secondly, and I don't know if anybody here could answer this, has any request or arrangement been made to the Ministry of Health for national athletes who have gone abroad to represent the country in terms of arrangements for quarantine, covering that cost, and for any exemption to these athletes on their return to Trinidad and Tobago?
So thank you for your questions. I'll take the first question. With regards to the scenario which you described, while I can't comment on the situation at hand because I don't know the clinical details of this elderly gentleman, I can say that worldwide there have certainly been reports of what we call vaccine-induced thrombosis and thrombocytopenia, which essentially means vaccines causing clots and dropping platelet counts. Those have been well reported. This is exceedingly rare and it's not very common, and the majority of patients taking the COVID-19 vaccine will certainly have no adverse events. Locally, I believe that we've reported 3 cases of clots due to vaccines, all of which the patients were stable. I do not believe that we've reported any fatalities that have been linked to vaccines, but I cannot comment on the exact situation described.
Okay, now just to tag on to that again, we just want to ensure that people understand that in spite of having a vaccination, if there are other comorbid or premorbid conditions from which a patient may have suffered prior to getting vaccine and separate and apart from having the vaccine, there are going to be individuals who may pass on subsequent to having been vaccinated, but not as a result of having been vaccinated. And we also want to ensure that people understand that when we speak about the deaths of individuals who had a first dose of vaccine, it was that they then went on to contract COVID-19 disease because they weren't fully vaccinated yet, and the COVID-19 disease was the eventual cause of their fatal outcome. So just again to clarify what we've been speaking about and the information that we've put into the public domain so far. With respect to the second part of your question, those queries are probably going to best be addressed either by the Ministry of Sport or the Ministry of Foreign and CARICOM Affairs with regard to the arrangements made by the sporting bodies for the foreign travel of the local athletes. So those questions are probably best redirected.
Appreciate it, Dr. Hines. We now go to the Newsday.
Good morning, everyone. Rihanna McKenzie from Newsday here. My two questions this morning are actually from the general public. So my first question is, what will gatherings look like for fully vaccinated people, and how soon can we expect those changes, if any? My second question is from someone who wants to know if it will be okay to take the Sinopharm vaccine a few days early, or maybe 3 to 5 days early before the date that they were given by the health center, and how would that affect the efficacy of the vaccine? Thank you.
Okay, two good questions. The first one, I think we're a little too early in the game to start looking at what gatherings will look like in a vaccinated group. In a population where we still have the vast majority of the population not yet vaccinated. We have about maybe 13% of the population overall that have full vaccination on board. We are working towards higher levels of coverage. So right now, it's going to be very difficult to try to plan a gathering or gatherings for vaccinated individuals. We're going to need to see a lot more of what happens in the near future with respect to introduction of new variants, with respect to behavior of the virus in the population when the population is better vaccinated, before we can start looking at whether to make changes or not. So it's still early days for that. Now, the scheduling of the second dose of the vaccine for Sinopharm in particular, say between 21 and 28 days. They do not recommend that you take the dose earlier than that, because going less than 21 days by, I think it said 5 to 6 days, is sort of shortening your second dose to a 2-week or just over 2-week period, and that doesn't do well with respect to the efficacy of boosting the immune response, working with the body's rhythm of generating an immune response. So when they give a timing, it is best to stick to the timing. There's a window, 3 to 4 weeks, and it's best to stick with that window.
Thank you very much, Dr. Hines. We now go to CL Communications. Thank you very much, Dr. Hines. We now go to CL Communications.
Hi, good day. Natalie Singh, Caribbean Lifestyle Communications. Hi, good day. Natalie Singh, Caribbean Lifestyle Communications.
There's an echo. Could you pose your question and turn down your audio, please? Could you pose your question and turn down your audio, please? Okay, so we seem to have some technical difficulties with CL Communications. We'll try just one more time. CL Communications?
Yes.
Okay. Ladies and gentlemen, we have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. And if you haven't received your COVID-19 vaccination as yet, please get yours now. Remember, the COVID-19 vaccines are safe, effective, free, and available right now. No appointments necessary. And so, especially through the drive-thrus and most of the mass vaccination locations. So go grab a jab and let's do your part. Let's vaccinate T&T. We leave you with another in our series of Voices for Vaccinations as Dr. Carla Maria Alexander speaks of the benefits of the COVID-19 vaccine. Let's listen in.
Vaccines have helped the world overcome many infectious diseases within your community and other countries. Some examples being polio, measles, and smallpox. So vaccines are very effective in managing and even eradicating an infectious disease. So what is a vaccine? Think of a vaccine as a form of medicine that teaches your immune system how to fight an infectious disease. So, in case you actually encounter that disease, your immune system already knows what to do to overcome it. How important are vaccines in our fight against the COVID-19 disease? Vaccines are very important in helping us manage this COVID-19 disease pandemic. And while there are many types of COVID-19 vaccines, there are two types that are presently being given to the Trinidad and Tobago public. They are the Oxford AstraZeneca vaccine and the Sinopharm vaccine. And the main highlight with both of these vaccines is that neither of them contain the SARS-CoV-2 live virus, the virus that is responsible for the COVID-19 disease. Basically, you cannot catch the virus from getting any of these vaccines. How safe are the COVID-19 vaccines? So the World Health Organization has a very robust regulatory process by which they test the safety and efficacy of these vaccines. Emergency use authorization does not mean that the vaccines are not safe, but instead that they made them available much quicker to the countries that are in need of the vaccines, especially in this public health emergency. What is the efficacy of the COVID-19 vaccines? Different vaccines have different efficacy rates, and while all of them are over the WHO 50% efficacy threshold, the two vaccines being utilized by the Trinidad and Tobago public are over 70% efficacy with regards to serious illnesses and hospitalizations. Who should and should not take this COVID-19 vaccine? Well, the vaccines have been approved generally for persons 18 years and over. But if you have a particular medical concern, please do not hesitate to contact your personal medical practitioner for advice on taking the vaccine. I took the vaccine for my health and the health of my friends, my family, my community, and my fellow citizens of Trinidad and Tobago. I want to encourage you that once a COVID-19 vaccine becomes available to you, I urge you to make an informed decision and vaccinate TNT.
Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking today about the Delta variant and vaccines. Dr. Soumya Swaminathan, WHO's chief scientist, is our expert today. Welcome, Soumya. Our first question to you, Soumya, is we know that the Delta variant is more transmissible. Please explain to us what kind of protection we get from the current batch of approved vaccines.
So we're talking here about the Delta variant, which is the fourth variant of concern described by WHO because it's both more transmissible than the previous variants and also has been able to resist the antibodies that we have in our blood. So what that means is that you need a higher level of antibodies to overcome this variant as compared to, let's say, the Alpha variant. Now, the good news is that all of the WHO emergency use listed vaccines do protect against developing severe disease, hospitalization and death due to the Delta variant. So there are studies now from countries where there is a predominance of Delta variant to show that people who've been vaccinated are much less likely to end up in hospital. And you need the full course of vaccination in order to give you that full immunity to protect you against the Delta variant. So the important thing is, if you have access to a vaccine that's approved by WHO, please do take it and take the full course so that you can be protected both against the Delta and other variants of COVID.
Soumya, explain to us, please, the level of protection that you have if you have received one dose of the vaccine versus if you're fully vaccinated.
So the main goal of these vaccines is really to prevent severe disease, because what we want is for people, even if they get the infection, is for them to recover from it and not become seriously ill. So that's something that all of these vaccines do really well. Of course, there are different levels. You read about the efficacy trials. They may range from 70 to 90%. But in terms of just looking at the prevention of severe disease and hospitalization, they're all very good, over 90% effective. Again, they vary in the protection against getting infection. Ideally, you'd like a vaccine which completely prevents you from getting infected, therefore you can't get ill. But none of the vaccines that we have currently are 100% protective. So this is why even if you're vaccinated, you can get the infection, but the chances are you'll get a very mild symptoms or no symptoms at all, and that your chances of getting seriously ill are really, really low.
So Soumya, if we can still get infected and also infect others, even after we are fully vaccinated, then why get vaccinated?
There are two very good reasons to get vaccinated. The first is to protect yourself from getting severely ill if you catch the infection. We know that there's a certain proportion of people of all age groups who do get severely ill, and you could have a chance of dying from this disease, and this is what we want to protect. So that's why you want to get vaccinated in the first place. But secondly, if you get vaccinated, and yes, you may still get the infection, because we know that these vaccines are not going to protect you 100% from the infection. So there is a small risk you get infected, and you could pass it on to others. Why do you want to take the risk of doing that? Why do you want to be one person in the chain of transmission? What we need to do in the world today is to break those chains of transmission, get a control on this disease. So that's why we say get vaccinated as soon as you can get access to your vaccine when your turn comes, and continue to take all the precautions so that you're completely protecting yourself as well as protecting others around you.
Thank you, Soumya. That was Science in 5 today. Until next time then, stay safe, stay healthy, and stick with science.
Five, 6, 7, 8, 9, 10. Making sure you can hear me, Mahalia, and I can hear you.
Yeah, I'm hearing you.
Hey, I'm so excited about it. Thank you, though.
Yeah.